Scientists around the world are constantly keeping track of these new COVID variants. How does that work?
Well, as you know by now, all viruses do mutate. It's something very natural. It happens randomly, and it often has little or no effect on the virus. But some mutations can indeed make it more lethal or more contagious, or the other way around. And the way it works is that scientists are, when they sequence the virus, they're going to spot the differences. So they're going to really compare the samples with other existing viruses and try to track where those mutations occur and if they occur in sensitive areas like on the spike protein. And depending on that information, they're then going to share it on an international database, and they're going to classify it in the WHO's typology. So there are three different categories. First, the most concerning, as the name suggests, are the variants of concern. So here you've been able to prove that the virus is more transmissible and more dangerous, that it can evade vaccines and natural immunity, and that it has already spread. The second category are the variants of interest. We'll be talking about that later. The mutations here, same thing. You have mutations that affect, of course, transmission and evades immunity, but this time you've only been able to prove that it happens in little clusters. And last but not least, you have the variants under monitoring. There are many of them. Same here, you have mutations, but you don't have the evidence that it does have an impact on public health.
So, Julia, there are now two new variants that are really these ones of interest, the ones to watch. Tell us about those.
So the first one is dubbed Mu after the Greek letter. The variant was first detected in Colombia back in January 2021, and it has since been spotted in South American countries, but also in Europe. For now, this variant is only considered as being a variant of interest, so it's not the highest category because, one, it has a very low prevalence around the world, but it has an increasing prevalence in Colombia and Ecuador. There's also mutations that could indicate that it could evade vaccines. Now, you have another variant that you've been hearing about, especially today. It's the C1.2, because in the media we've been hearing that it is mutating twice as fast as other variants. Now, in reality, we should not be as alarmed. It has indeed mutated a lot in a very short period of time, but as has other variants such as Delta, it doesn't mean it's going to continue to mutate at that same pace. And also, we don't have evidence today that those mutations are changing the behavior of the virus. So we have a graph here. It appears that you're going to see it appear in red. It's at the same level as the Delta. So we see that there are a lot of mutations. But once again, it doesn't mean it's getting more deadly. It hasn't been categorized as a variant of concern or interest. So once again, we should really be cautious.
Right, Julia, thank you so much for that. Julia Seeger, our health editor, talking about those new variants with the COVID-19. Thank you very much.